Hello, 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 doctors. How is everybody doing today? I'm excited to see you and I'm excited to study with you. We are in the exam period. The new format of the MCCQE1 has started on April 9th, and so people are gearing up. And for me today, I want us to deal with one topic that candidates really, really struggle with. So I'm excited about it. I hope you're also excited. So please just let me know where you are joining me from. And I'm going to, run through this class because the MedCognito students just after this class at 3 p.m. EST have a med drill. We decided to do 6-hour med drills every month. But, because of exam anxiety and everything, what we decided to do is to conduct some back-to-back med drills for the candidates. So, if you want to join, and this is, your last minute review for the exam. So if you want to join, great. After that, just send me a text because they'll be starting the med drill at 3 p.m. EST. So let's jump right into it. Approach to acid-base abnormalities. Many candidates at times tell me, oh, Dr. Boni, I struggle with this. So what I've always told them is that, look, let's deal with this. And in the past, I've taught a class and I've helped candidates to, determine what metabolic acidosis is, respiratory acidosis, and we end it there. But someone also reached out to me that, Dr. Boni, what about the compensation part, right? What about the compensation part? So today we're going to go through the basics and then we'll add on the compensation part. So if you've seen that class I've done on acid-base abnormalities, this takes it to another level altogether. So doctors, I can't wait for us to get into it. So let's do it. Let's do it right away. So I'm going to share my screen and then the games will begin. Now, abnormally high or low hydrogen ion concentration, acidemia or alkalemia, respectively, is encountered relatively frequently, particularly in hospital-based practice. Okay, so if the hydrogen ion concentration in the blood is low, we call it acidemia. If the hydrogen ion concentration in the blood is high, we call it alkalemia. Okay, now acidemia may be caused by an underlying life-threatening condition, and several acid-base abnormalities can coexist in a single patient, and that is why you can have a mixed picture as well. Now, there are some causal conditions. We have what we call high anion gap metabolic acidosis, normal anion gap metabolic acidosis. And in the course of these lectures, maybe one of these days we'll also pick a time and really deal with these things. But for today, we are going to crunch how to break down what is metabolic acidosis, what is respiratory acidosis, just by looking at the figures. Okay, so the high anion gap metabolic acidosis, it can be from exogenous sources like methanol, like patients who are in ketoacidosis. Okay, and then you can also have normal anion gap metabolic acidosis. For example, somebody who has gastrointestinal bicarbonate loss, for example, diarrhea, right? And then patients with renal bicarbonate loss, like renal tubular acidosis and interstitial nephritis. So please, on this slide alone, this is very, very important. Causes of high anion gap metabolic acidosis, for example, methanol, ketoacidosis. Causes of normal anion gap metabolic acidosis, for example, diarrhea, for example, renal tubular acidosis, for example, interstitial nephritis. All right. Now, we also have metabolic alkalosis, and we have the expanded effective arterial blood volume, where maybe a patient has mineralocorticoid excess or contracted effective arterial blood volume, for example, from GIT loss. Remember that we have hydrochloric acid in the stomach. So if you have a patient who is having vomiting, losing the hydrochloric acid, then the patient may become alkalotic. And we also have renal losses like diuretics, okay, and exogenous ingestion. And then when we come to respiratory acidosis, why will a patient develop respiratory acidosis? The causal condition can be neuromuscular causes. So a patient who is taking medications, illicit drugs, neuromuscular disease, and pulmonary causes of decreased alveolar ventilation. For example, severe asthma exacerbation with impending respiratory failure. Okay, and kyphoscoliosis and hypoventilation. These are all causes of respiratory acidosis. So if you're taking your notes, I need you to write all of these down in your paper. And please don't forget to send me, a screenshot of what you are doing. I love to know where you are listening from or watching us from. Some people, last time when we are done, somebody sent me a nice picture of food and, how he was enjoying it with his family, and it was beautiful. I really, really like that. Okay. Now, and respiratory alkalosis is also seen in hypoxemia with tachypnea, and then metabolic causes like patients with liver failure, okay, and cardiopulmonary disorders like pneumonia, pulmonary embolism, okay, and central nervous system disorders like subarachnoid hemorrhage, drugs like salicylates, okay, and then miscellaneous issues like fever if a patient is in pain and pregnancy. Now, given a patient with acid-base abnormality, the candidate will diagnose the cause of the acid-base abnormality, the severity of the acid-base abnormality, and complications, and will initiate an appropriate management plan, okay? Particularly when dealing with a high anion gap metabolic acidosis. So if you remember those things we talked about, diabetic ketoacidosis, patients with methanol, the medical council is telling you that if there is one particular, or if there's a set of acid-base imbalances you must master, don't forget to master patients with high anion gap metabolic acidosis. So therefore, if I were you, after this class, after the med drill, okay, pick your paper, go to your MedCognito portal, and make sure that you've reviewed your management of diabetic ketoacidosis, management of methanol overdose, right? At least those two, make sure that you have evaluated them very, very well. Now, enabling them. So I just gave you a clue, right? Because based on this particular key objective, the candidate must be able to initiate an appropriate management plan, okay, particularly when dealing with high anion gap metabolic acidosis. So how do you manage a patient with, what are the causes of high anion gap metabolic acidosis? For example, methanol, for example, diabetic ketoacidosis, right? So you must know how to manage these according to the objective, right? Now, enabling objectives. Given a patient with acid-base abnormality, the candidate will, through efficient and focused data gathering, diagnose the cause of acidemia or alkalemia expeditiously. And that is where we are going to focus today. Through efficient and focused data gathering. Okay, so what is the pH saying? What is the HCO3 saying? What's the CO2 saying? And based on this information, what is my diagnosis? This is exactly what we are doing today. Okay, so listen, interpret critical, clinical, and laboratory findings that are key in the processes of exclusion, differentiation, and diagnosis, including those derived from an accurate arterial blood gas analysis and complementary investigations for acidemia or alkalemia aimed at identifying the primary abnormality and adequacy of associated secondary compensation. Doctors, let me send this to one of the doctors. They are saying they can't see what is happening. Okay, so I'm just sending this to them so that they can all join. Okay, good. All right, so let the games continue. Because as we teach, people are, Dr. Bonnie, I can't see the slides. Okay, so that's why I want to deal with it. So listen, interpret critical, clinical, and laboratory findings that are key in the processes of exclusion, differentiation, and diagnosis, and including those derived from an accurate arterial blood gas analysis and complementary investigations for acidemia or alkalemia aimed at identifying the primary abnormality and adequacy of associated secondary compensation, and construct an effective initial management plan for acidemia or alkalemia. So if you have a patient who develops acidosis, you must know how to manage the patient. If you have a patient who develops alkalosis, you must know how to manage the patient. Okay, describing general supportive measures describing management of specific acid-base disorders. So that's what I was saying. For example, a patient with aspirin toxicity. Aspirin toxicity has a unique way it presents. Know how to manage it. A patient with methanol overdose, according to the medical council, you must know how to manage it. A patient with diabetic ketoacidosis, according to the Medical Council of Canada, you must know how to manage it, right? So somebody comes, Dr. Bonnie, what are the high yield topics I need to know? I go to the objectives. Everything is there. And if so far as you are following the objectives, you realize that you are nailing bam, 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 okay? And then determining whether the patient needs to be referred for consultation. So in class today, we'll focus on the toughest parts of to make it simpler, because a lot of candidates struggle with, this breaking down, especially when it comes to this part through efficient and focused data gathering. A lot of candidates struggle with that. So doctors, before we get into it deeply, I want to make sure, please send this link to as many friends as possible, like in your WhatsApp groups, in your Telegram groups, in your in all the groups you belong to, in your faith. No, let them join so that we can all study this thing together. So let's go through this, interpreting acid-base abnormalities. I need you to remember just three things. Just three things. You just need three things, and you're going to ace the exam. Just three things. So I need you to pick your pen and paper and write some things down. We are going to learn normal values. We are going to learn the function and controlling organ of these values. And then we are going to interpret the results in three simple steps, okay? And all you're going to do is arrows, up, down, up, down. That's all. And acid-base balance is in the bag. So the three labs I want you to watch out for are pH, CO2, and HCO3. Please, I want you to type it in the comment section right now. Please type it in the comment section. pH, CO2, because this is very important. That's all you need. pH, CO2. Okay, pH, CO2, and HCO3. These are the only things you need to know. Please write them down. pH, CO2, HCO3. pH, CO2, HCO3. Dr. Moajon, I see that you've done it. She's a very serious candidate. I love her spirit, She's always in class. She's always, reading questions. She's always contributing. Please, pH, CO2, HCO3. Let's make acid-base balance ridiculously simple today. Okay? Now, for the pH, I need you to write this number. 7.35 to 7.45. Simple. 7.35 to 7.45. pH. If a patient's pH is low, below 7.35, we say the patient has acidosis. If the patient's pH is high, above 7.45, we say the patient has alkalosis. Keep it very simple. 7.35 to 7.45. Doctors, while we're also doing this, please, I want to encourage you, go to the MedCognito YouTube channel right now, okay? And click on the like and subscribe button. Please do that, because the more you do that, the more we get, other doctors to also see the content, so we can all prepare. So please remember, pH 7.35, 7.45. If I read my question stem and the pH is less than 7.35, the patient is acidotic. If the pH is more than 7.45, the patient is alkalotic. Keep it simple. MCCQE1 made ridiculously simple. Next one I want you to look at is CO2. And what's the relationship here? Remember that the pH was 7.35 to 7.45. And so the CO2 is very simple. It's 35 to 45, right? So 7.35 to 7.45. CO2 is 35 to 45. Now, remember that we said that when the pH is less than 7.35, the patient is acidotic. When the pH is more than 7.45, the patient is alkalotic. When it comes to carbonic acid, that is CO2. Always remember that CO2 is an acid, carbonic acid. So that means if CO2 is high, it's like you're dealing with, acidosis. Okay, I'm just saying that. Just remember that. Now, Remember that CO2, carbon dioxide, people, CO2, that's what some people say. Remember that CO2 is regulated by the lungs or respiratory. Please, I want to make sure that we building this step by step by step by step by step. So please, if you are following me so far, just type yes, yes, yes. We've dealt with pH, we've dealt with CO2. We've dealt with pH, we've dealt with CO2. Okay? We've dealt with pH and CO2. Doctors, please, if you are following me, just type yes, 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 yes. I want to be able to finish this class so that you can join the med drill on Zoom. Okay? So please, yes, 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 beautiful. And remember that CO2 is managed by the lungs. Let's move on to the next thing. So remember that CO2, I said, is acidic, right? So if you are blowing off CO2, that means you are reducing the acid in the lung, so-called, right? So if somebody is breathing faster and deeper, they are going to blow off more CO2, and therefore they decrease the acid in the body. All right? All right? And if they are not breathing well, that means that they are building up CO2 in the body. Therefore, they are increasing acid in the body. Right? So if the person is breathing faster, the person is blowing off the acid. If the person is breathing shallow or not breathing well, they are building up acid in the body. So faster breathing reduces CO2 in the lungs. Slow breathing builds up CO2 in the lungs. Doctors, can I move on? Just type yes, let's go. Just type yes, let's go. Just type yes, let's go. So we've talked about pH, we've talked about CO2. Okay, so now let's talk about HCO3. Remember, I told you just need three things. HCO3, you just need three things. pH, which is 7.35, 7.45. CO2, which is 35 to 45. And then HCO3, that is where the number changes a bit. That is 22 to 26. 22 to 26. Okay, please, I need you to write this in your books and send me a screenshot right now on my phone. I want to see it. My phone number is what is underneath the screen. +1 306 891 5649. +1 306 891 5649. pH 7.35, 7.45. If pH is low, it's acidic. pH is high, alkalotic. CO2 is 35 to 45. If CO2 is high because it's acidic, then we are concerned about that as well. And then HCO3 is 22 to 26. Now, remember, while CO2 is acidic, HCO3 is basic or alkaline, right? And that is controlled by the kidneys, and that is what we call, like, what we call metabolic. And usually, it is slow to respond. So while CO2 responds quickly, HCO3 responds slowly. Doctors, can I move on now? We've talked about all the three things we need to remember. Can I move on? If yes, just type move on. Today, I will need a lot of responses from you, okay? Because this is not a Zoom class, so I can't hear you. So I will need a lot of responses. If I should move on, just type move on, move on, move on. Dr. Bonnie, move on, move on. Okay. Now, so let's review the numbers again. 7.35, 7.45. Then PCO2 is normal between 35 to 45. Then HCO3 is 22 to 26. Okay. Now, the first parameter I want you to look at is arrows. Just arrows. Arrows. You just need arrows. So in the exam, just think about arrows. Top, down. That's all. Okay? That is all. That is all. Arrows. 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 Now, the first thing you want to look at in every acid-based question is the pH. Always remember that pH is boss. pH is the boss. So pH is the one who dictates everything. So first, ask yourself, according to the pH, is the patient acidotic or alkalotic? That's the first thing. That's the first thing. According to the question stem, is the patient acidotic or alkalotic? pH is the boss. Please write it for me. pH is the boss. pH is the boss. Okay? pH is the boss. Now, when you've gotten your pH right, for example, I tell you in the question, the patient's pH is 7.25. That means the patient is acidotic. The patient's pH is 7.15. That means the patient is acidotic. The patient's pH is 7.28. That means the patient is acidotic. What if I say the patient's pH is 7.60? That means that the patient is alkalotic, right? So remember, pH is boss. pH is the one who dictates everything. Doctors, are you following me? Okay, good. Now, after I've determined the pH, is the patient acidotic or alkalotic? That's all I need to know. The next thing I want to look at is CO2. So pH is the boss. Now, after pH, look at CO2. Remember that the CO2 is also between 35 to 45, right? Now, so for example, if I draw my pH arrow, pH, and it is going in one particular direction, and the CO2 arrow is also going in an opposite direction, that means that the problem I have is a respiratory problem. Doctors, you were like, Dr. Bruni, I thought this was very difficult. No. pH is boss. So if pH is going south, which means acidosis, and CO2 is going north, then that problem is respiratory and I'm done. So if pH is going south, acidosis, and CO2 is going north, up, that means that this is a respiratory acidosis problem. As soon as I see that pH and CO2 are going in two different directions, forget about HCO3. Forget about it. You can confidently stick your neck out and say that this is a respiratory problem. If pH and CO2 are going in opposite directions. So for example, let me give you an example again. pH is 7.21, that is alkalosis. CO2 is 60. So while pH is going down, CO2 is going up. That means the patient has respiratory acidosis. Doctors, did you hear me? Is it well? Is it well with you? If it is well with you, just type, it is well with me. It is well with me. Doctor, as I said, this one, I should have done it on a Zoom call. Okay, so that I can really hear your verbal response. But because it is on YouTube, I really need your response, right? Dr. Bonit is well with me. Beautiful. So remember, so if pH is going up, say 7.60, that means the patient is alkalotic, and CO2 is going down. That means it is respiratory alkalosis. Simple. The only problem comes if pH and CO2 are going in the same direction. So for example, if pH is going down, that's acidosis, and CO2 is also going down, that is when we have to call in our friend HCO3. Let me say it again. If pH is going down and CO2 is also going down, that means that we cannot conclude. Therefore, we need our friend HCO3. So always remember, pH is boss. If pH is going in an opposite direction with CO2, I know that I'm dealing with a respiratory problem. But as soon as pH and CO2 are going in the same direction, I go like, no, I need to bring in HCO3. Okay? So, let me say it again. Let me go back. If pH is going up and CO2 is going down, that means that I have a respiratory alkalosis problem. But if pH is going up, CO2 is also going up, then I bring in HCO3. If pH is going up, CO2 is also going up, and HCO3 is also going in the same direction as pH and CO2, then we have a metabolic problem. Let me say it again. Exactly. I like that. Dr. Farrakhan, thank you very much. Dr. Farrakhan says that HCO3 is the marriage counselor. So pH says, I'm going north. CO2 is also saying, I'm going north with you. And then the HCO3 comes saying, oh, the two of you are all going in the same direction. Therefore, you have a metabolic marriage issue. You know, you have a metabolic marriage issue. So if pH is going up, that is alkalosis. CO2 is also going up. Therefore, we bring HCO3 in. If both pH, CO2, and HCO3 are going up, the patient has metabolic alkalosis. Beautiful. Now, pH is going down. CO2 is also going down. HCO2 is also going down. So we have a metabolic problem, and it is metabolic acidosis. That is all. This is it. This is all that we've been doing. This is it. So now let's take our time and look at respiratory acidosis. Very simple. Let's break it down. Remember that we said CO2 is acidic. Now, what will cause somebody to develop respiratory acidosis? If somebody has respiratory acidosis, that means that that patient is building up CO2. And so respiratory acidosis, I have to remember somebody who is not breathing well. Somebody who is not breathing well. So somebody who has slow breathing or very, very shallow breathing. And what are the causes of slow breathing? It could be that the patient is on a mechanical ventilator, but the ventilator settings have not been set up well. It could be that the patient has underventilation. It could be that the patient has CNS depression. Doctors, please, I need you to follow me. Are you following me? Are you following me? Are you following me? It could also be that the patient has head injury. So think about all the things which will cause the patient to breathe shallow and therefore build up CO2 in the body. Okay, it could be that the patient has taken opiates. It could be that the patient has taken benzodiazepines, illicit drugs, chronic obstructive pulmonary disease, kyphoscoliosis. Therefore, the patient cannot breathe well. Hypoventilation due to obesity. Come on now, if you're following me with this, causes of respiratory acidosis, where we are building up CO2. We got it right? Now, so in respiratory acidosis, what's the equation? Remember, in acidosis, pH is down. And when will we get to respiratory? When CO2 goes in the opposite direction of pH. So pH is down, CO2 is up. Therefore, we don't even need to look at HCO3. If pH is down and CO2 is up, this patient has respiratory acidosis. Doctors, please write it down in your book. If I have a patient whose pH is, say, 7.21 and CO2 is, say, 60, this patient has respiratory acidosis. Please, doctors, does this make sense? I really want to know. I'm not going to leave anyone behind. Does this make sense? Does it make sense? Please, does it make sense? Does it make sense? pH is down, CO2 is up, HCO3 is non-consequential. We don't worry about it. So far as pH and CO2 are going in the opposite direction, that marriage has failed. That is, it's a respiratory marriage. That means that we don't need a marriage counselor who is HCO3 to come in. All right? Good. Thank you. I like the responses. Dr. Bironke says, this class is for me. Beautiful. Beautiful. Okay. Doctors, don't forget, please, don't forget to subscribe to the YouTube channel. Okay. Let's go. Now, what about respiratory alkalosis? Remember that we say for respiratory, pH and CO2 must go in opposite directions. So in respiratory alkalosis, that means that the patient should be blowing off a lot of CO2. So the patient, the patient just was running away from a lion. That kind of thing. Or if the patient is on a mechanical ventilator and the ventilator has been set such that the patient is hyperventilating on the ventilator. So you realize that it's not everyone on a ventilator who has respiratory acidosis. It all depends on how the respirator is set. So if you have somebody who is inexperienced and set the respirator so that the patient is taking just shallow breaths, then the patient will be in respiratory acidosis. If the person sets the respirator, said that the patient is breathing then the patient is respiratory alkalosis, right? Doctors, please, are we all good? Are we all good? Are we all good? Can I move on? Can I move on? Can I move on? I'm really enjoying this class. Can I move on? Beautiful. So in respiratory alkalosis, remember that respiratory issues, pH and CO2 will go in opposite direction. But how will I know this is alkalosis? Because the pH will be up and CO2 will be down. I will not think about HCO3. HCO3 can think about itself. I will come to that. Okay? So, doctors, this is it. Now, in metabolic acidosis, so we've done respiratory acidosis, respiratory alkalosis. Now, in metabolic acidosis, when do we say something is metabolic? We learned that when pH is down, CO2 is down. Because of that, we bring in the marriage counselor. The marriage counselor comes to look at the marriage and says that, look, you guys are in a wonderful marriage. You guys are all going in the same direction. Therefore, continue. Okay? Therefore, continue. So, in respiratory acidosis, in metabolic acidosis, think about down, 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 down. pH is down. CO2 is down. And HCO3 is also down. Right? Please remember that. In metabolic acidosis, pH is down. CO2 is down. HCO3 is also down. All three of them are down. And this is seen in end-stage renal disease, diabetic ketoacidosis, lactic acidosis. All right? So that is it. Remember, down, down, down. That is metabolic acidosis. Therefore, pH will be down, CO2 will be down, and HCO3 will also be down. Now, let's talk about metabolic alkalosis. That one, everyone is up, 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 up. So, pH dictates the pace. We are going up above 7.35. Then CO2 will also come above above 7.45. Then CO2 will also come above 45. Then the marriage counselor will also come above 26, right? Therefore, in metabolic alkalosis, everything is up. In metabolic acidosis, everything is down. In respiratory acidosis, pH is down, CO2 is up. So you realize that when it comes to the metabolic situations, that is when we bring HCO3 into it. So in metabolic alkalosis, think about up, 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 up. Doctors, please, I don't want anyone to be lost. If you've enjoyed the class now, just let me know. If you've enjoyed the class up to this point, everything is making sense to you, just let me know. Say, Dr. Bruni, move on, move on, move on, move on. Move the stuff, move the stuff. Move the stuff for us. Move it, move the stuff. Make QE1 ridiculously simple. Okay, so I should write on. Thank you very much. So what are the causes of metabolic alkalosis? Vomiting, diarrhea, excessive antacid use, diuretics. Okay, so in metabolic alkalosis, everything is up, up, up. Okay, everything is up, up, up. So somebody is asking, Dr. Chiagozi, she asked the question, why will CO2 be high in metabolic alkalosis? That is what we'll be answering at the end of this class. Because people ask, they were like, Dr. Bruni, we want to learn about the compensation. That is when compensation comes in. Okay? That's when compensation comes in. Why will CO2 be up when pH is also up? Compensation. Because don't forget that CO2 is an acid. Remember that. And if pH is up, that means the patient is in a metabolic is in an alkalotic state. So CO2 is going up. It is being built up so that it can counteract the alkalosis. So you realize that why does CO2 go up in a patient whose pH is also going up? Because the body is trying to compensate. That is what we call compensation. Okay, so now with all that we've done, doctors, let's try some questions quickly. We have 20 minutes to finish this. I'm hoping we can be able to finish it. Okay, I'm hoping we can be able to finish it, or else we may have to beg Dr. Nana to move her class by 30 minutes. But let's go. So now let's try these questions. A 45-year-old male presents to the emergency department with severe diarrhea for 3 days. He is lethargic and complains of weakness. His lab values, pH is 7.30. So in this case, pH is low. CO2 is 35. Remember that the CO2 is between 35 to 45. HCO3 is 18. So from the word go, the patient is in an acidotic state because pH is less than 7.35. That's the first thing. Now, PCO2 is on the low side. It's on the low side, right? It's on the low side. Therefore, it looks like pH is going down. PCO2 is also coming down. So we have to bring in HCO3. Now, HCO3, what's the normal range of HCO3? 22 to 26. So HCO3 is also low. So pH is low. PCO2 is low. HCO3 is also low. So what did we say? If you have low, 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 what then becomes the correct answer? The correct answer is A, metabolic acidosis. Beautiful. Doctors, we got it right. We got it right. We got it right. So now, let's run through it. Please, if you are happy, let me know. If you are happy, let me know. This class is awesome. I love it. If you are happy about what you are learning today, please let me know. So everything is going down. Everything is going down, 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 right? Okay, let's go to another one. You have a 50-year-old female with a history. Look, let's even forget about all the reading and start. pH is low, but PCOS is 55. So that is high. So pH is low. That is acidosis. And CO2 is high. So we said that if pH and CO2 are going in opposite directions, that means we are dealing with a respiratory problem. So without even looking at CO3, without even reading the question stem, this patient has has an acidotic problem and it is respiratory. Therefore, this patient has respiratory acidosis. The answer is C. Boom, 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 boom. The answer is C. Yay! I'm so happy. Look, doctors, we are picking it up. I'm very happy. Let's go to the next one. So now we're just going to solve questions. Okay, forget about the reading. What are the lab values? pH is 7.52. So 7.52, that means that it is more than, it is going up, right? Because pH is 7.35 to 7.45. Then, so pH is going up. And PCO2, it should be 35 to 45, but this one is 30. So PCO2 is going down. And so this then becomes a respiratory alkalosis case, right? The pH is high, PCO2 is low. Therefore, the answer is D. Oh, come on now. Come on now. Come on. Dr. Jackie, Dr. Celebrating Collins, you know, it's awesome. Whenever I'm teaching acid-base issues, I'm so excited about it. So, doctors, let's do another one. Let's do another one. Forget about the reading. Forget about the reading. pH is 7.55, so that is high. PCO2 is 28, so that is low because PCO2 is between 35 to 45, right? So pH is going up, PCO2 is coming down. So that means the patient is alkalotic, and because PCO2 is going in opposite direction, that makes it respiratory alkalosis. So the answer is D, 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 D. Next one. Forget about the reading, right? Forget about the reading. Now the pH is 7.50. PaCO2. So 7.50 is high. PaCO2 is 45. So that is borderline high, right? And CO3 is also 33. That's also high. So they are all going in the same direction, up, up, up. Now, pH being up means the patient is alkalotic. Alkalotic. Therefore, it becomes a metabolic problem. And therefore, we have metabolic alkalosis. B, B, B. Doctors, hey, next one. Next one. Forget about the reading. pH is 7.25. PCO2 is 60. 7.25 is low. So pH is low. pH is already determining it. It's low. PCO2 is high. So they are going in an opposite direction. So this becomes a respiratory problem. And therefore, this patient has respiratory acidosis. Boom. Boom. Next one. pH is 7.50, high. PaCO2 is also high because PaCO2 is between 35 and 45. So both of them are high. Now we bring in HCO3, and HCO3 is also high because they are all going in the same direction. Therefore, this patient has metabolic alkalosis. Simple, simple, easy peasy. B, 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 metabolic alkalosis. Next one. pH is 7.48, so that is high. So this is an alkalosis problem. PaCO2 is 30. That is low. So they are going in opposite directions. Okay. So there's an alkalosis problem which is going in opposite direction. Therefore, it makes it respiratory, right? So this patient has respiratory alkalosis. That is D. 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 Dr. Irina Osajman says she's excited. I love it. I don't know. Acid-base issues, I love it. Okay. Doctors, please, this is it. This is all there is. Okay. And then we'll be adding on the compensation. So next one, pH 7.33. Okay, it's low because pH is 7.35, 7.45. Then CO2 is 32. That is also low. So they are going in the same direction. We bring in a marriage counselor. Okay. Marriage counselor is also low, HCO3, because HCO3 is between 22 and 26. So that means it is down, down, down. And if it is down, 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 and all of them are going in the same direction, that makes it a metabolic problem. And pH is down. So that means it is metabolic acidosis. And if it's metabolic acidosis, that is A. Woo-hoo. Doctors, next one. pH is 7.28. PaCO2 is 50. 7.28 is low, but PaCO2 is going in the opposite direction. This one becomes a respiratory problem because pH and CO2 are going in two different directions. So this becomes a respiratory acidosis problem. Therefore, the answer is C. Doctors, are you not tired? Are you not tired yet? Are you not tired? Oh my goodness. I've enjoyed today's class. Okay. So doctors, this is it. This is it. This is it. I can show you so many case scenarios. So many case scenarios. Please don't forget to subscribe. Click and subscribe on the YouTube channel. Please subscribe. Let's grow the channel. Please. Let's grow the channel together. Okay? Let's grow the channel. Please, who is excited today? Who is excited today? Who is excited? This is a problem a lot of people have faced. And now we're going to go to the second part. But let's summarize. Let us summarize the table. Someone says what? Dr. Bruni, please give me your money. Your energy, sorry. Dr. Bruni, please. Oh my goodness. I really love this. I really love this. So let's summarize the table. It's the same thing we are looking at. In respiratory acidosis, remember that pH will be less than 7.35. And then CO2 will be more than 45. And because of they are going in two different directions, I'll not even look at HCO3, right? The same with respiratory alkalosis. pH will be above 7.45. CO2 will be below 35. Therefore, I'll not look at HCO3, right? And in metabolic acidosis, pH will be less than 7.35. CO2 will be less than 35. Therefore, I need to bring in HCO3. And they are all going down, down, down. Okay? Down, down, down. Down, down, down. And then in metabolic alkalosis, pH will be above 7.45. And therefore, CO2 will also be above 45. And because of that, bring in HCO3. And when you bring in HCO3, you realize that everything is up, up, up. This is it. Respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis, made it really simple. All right? This is it. Now that you understand the way to generate respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis, let's go to compensation. And compensation is very simple. Compensation is very simple. You know why? Remember just one trick. The body always compensates using the opposite system. Oh my goodness. So please write this one down. Write this one down. Write this one down. That the body will always compensate using the opposite system. Right? So if somebody has a problem with the left eye, the right eye will overcompensate. Right? If somebody has a problem with the right hand, the left hand will overcompensate. In the same way, in acid-base issues, it is a relationship between the lung and the kidney. Therefore, if there's a respiratory issue, you realize that the compensation will be coming from the kidney. And if there's a kidney issue, you realize that the compensation will be coming from the lung. Did you take your time to look at that? So the compensation comes from the opposite organ. So if it's a respiratory issue, the compensation will be coming from the lung, the kidney. And if it's a kidney issue, the compensation will be coming from the lung. In other words, if it's a metabolic issue, the compensation will be respiratory. And if it's a respiratory issue, the compensation will be metabolic. All right? So you realize that this doctor is like, what do you mean by that, Dr. Brody? The body compensates using the opposite system. What does that mean? What it means is this. It is lung versus kidney. It is lung versus kidney. What do I mean by that? It is lung versus kidney. Let me say it again. It is lung versus kidney. It has always been the lung versus kidney. The lung controls CO2. The kidney controls HCO3. Simple. So, let me go. If it is a metabolic problem, that is, the kidney is doing its thing, look for compensation in the lung. And if it's a respiratory problem, look for a compensation in the kidney. What do I mean by that? Now, let's take the knowledge and work through some questions. Yes, they are friends and they try to save each other. So now bring on the cases. Let's go. So this patient, the pH is 7.31. Please, let's take our time and work through it. HCO3 is 18. CO2 is 28. I have a question. Is this a metabolic or a respiratory problem? First and foremost, is this a metabolic or a respiratory problem? Don't forget what we learned. Opposites and same direction. So let's say pH is 7.31. So this is an acidosis problem, number one. Number two, HCO3 is also 18 and CO2 is 28. Remember that we always, after pH, we go for CO2. Okay, so pH is 7.31, so the patient is acidotic. CO2 is 28 and it is also going down. So we have pH going down, CO2 is also going down. Therefore, let's bring in HCO3 and see. Is HCO3 going in the same direction? Oh, so this is down, down, down. Therefore, this is a metabolic acidosis problem. So the first question is this a metabolic or respiratory acid-based problem? The answer is it's a metabolic acid-based problem. Next one, if it's a metabolic acid-based problem, that is that the kidney is the main thing, where am I expecting the compensation to come from? The compensation will come from the lung, not the kidney, because the problem is a metabolic acidosis issue. Therefore, what will be my final diagnosis? Let's work through it. The pH was low, so this is acidosis, right? CO2 was also low, so they are going in the same direction. Therefore, I bring in HCO3. Hey. Now, HCO3 also came and HCO3 is also going in the same direction. Therefore, I have a metabolic acidosis problem. And remember our rule that the opposite place compensates. So if it's a metabolic acidosis problem, if that means the problem is a kidney problem, then the compensation will come from the lung. And if the compensation is coming from the lung, that is metabolic acidosis with respiratory compensation, which is alkalosis. So this patient has metabolic acidosis with respiratory alkalosis. Simple. Doctors, simple. So first, remember what we did, all the examples we went through. Remember that, and then now look at the compensation part. So if it is a metabolic issue, remember the compensation will be respiratory. And if it is an acidosis issue, then remember that the compensation will be alkalosis. That is it. This is not difficult. Now people are thinking about nephric tubules and all those things. Oh, come on. Look, we are going to write QE1. It's at the level of a medical student. So remember, if it's a metabolic issue, the compensation will be respiratory. If it is an acidotic issue, the compensation will be alkalosis. Simple. Let's go through this one. pH 7.33. Therefore, is it an acidotic issue or an alkalotic issue. This is an acidosis issue. That's the first question. What's the direction of CO2? The direction of CO2 is that CO2 is high. CO2 is high. So pH is going down, CO2 is going up. So this is a respiratory acidosis issue. Do I need HCO3 to come in to help me make my diagnosis? No. So if it's a respiratory acidosis issue, where do I expect my compensation to come from? My compensation should come from the kidney. So what then becomes my final diagnosis? Let's work through it. pH is low, that's acidosis problem. CO2 is going up, so it is a respiratory acidosis problem. I don't need HCO3. I will not worry my head about that, right? Now, therefore, there is a respiratory acidosis problem. Now, where is the compensation going to come from? The problem is respiratory, therefore compensation will be metabolic. The problem is acidosis, therefore compensation will be alkalosis. And therefore, my final diagnosis for this case is respiratory acidosis with metabolic compensation, which is metabolic alkalosis. Come on now. This is it. This is it. This is it, doctors. This is it. This is it. So let's try some final questions to solidify everything before you guys jump into the med class, because we have 3 minutes to go. But look, let's try some more questions. But doctors, before that, remember, if you're excited about this, this is what we do at MedCognito, right? This is what we do. And because the exam is, we are in exam period, we're also helping candidates with their fears and everything, helping them. And if someone can score 301, you can also do it too. Okay, if someone can score 301, you can also do it too. All right, so in MedCognito, you're going to get line upon line review of everything. Doctors, stick with me because we're going to solve more questions. Every month, you're going to get 14 live classes. Okay, so you're going to get about 42 hours of tutoring. Doctors, it's not a joke, right? And you get mock exams in your portal, as well as every other Wednesday, we conduct another mock exam. So on the 21st of April, we have another mock exam coming up. Okay, and then you have personalized interactive study portal as well. Okay, personalized interactive study portal as well. So everything is for you. You see your name and everything there. So you have all these portals for you where you can go in to study. Okay, and you have 2,700 topics reviewed in 45 hours, which we call med bullets. Okay, so this is in family medicine alone, where you can just keep it going, and you can just study it, and all this with the energy on top, which is the cherry on top of the cake. It's only 2,199 CAD for 6 months. Okay, but someone will say, Dr. Boni, I cannot pay one time. Doctors, you can even do it every month. It's just 420 every month. And if you want just 1 month access to all the energy and everything MedCognito has to offer, it's only $450. Doctors, my phone number is what is at the base of the screen. Send me a message right away. Let's get talking. Let's get you into the program, right? Before the class started, I got a message from one candidate from Nigeria enjoying the class so much. So doctors, don't forget that today, right after here, in fact, the time is up, you've got to jump into a med drill session for MedCognito candidates. So if you want to be part of it and you're not a MedCognito candidate yet, send me a message right away. Send me a message right away. Send me a message right now. Let's go in. Okay, now let's finish with some questions. 40-year-old, so this time we are going to help with it. 40-year-old man has the following labs. pH is 7.29, HCO3 is 16, CO2 is 30. What is the acid base disorder? Let's work through it. pH is less than 7.35. So that is, the patient is acidotic. Let me look at CO2. CO2 is also less than 30. So they are both going in the same direction. HCO3 is also going in the same direction. Okay, so that means this is metabolic acidosis. Now, where am I expecting the compensation to come from? It will be respiratory. And the case is an acidosis problem, which is metabolic. Therefore, I'm expecting the compensation to be respiratory and alkalotic. So this patient should have metabolic acidosis with compensatory respiratory alkalosis. So what then is the answer? The answer will be A, right? Beautiful. The answer is A. The answer is A. This patient is metabolic acidosis with respiratory compensation. That is it. Next one. I see people getting it right. Next one. Patient's pH is 7.34. So that is low, right? Because pH is 7.35, 7.45. Then the CO2 is high. So pH is low, CO2 is high. That means it's a respiratory problem and a respiratory acidosis problem. Now, where am I expecting the compensation to come from? It should be a metabolic compensation. And since it is respiratory acidosis, it should be respiratory acidosis with metabolic alkalosis, which is compensating. So what's the correct answer? Respiratory acidosis with metabolic compensation. Beautiful. And that is B. That is B. That is B. Doctors, that is B. Next one. I have a patient. pH is 7.48, so that is high. CO2 is low, so that means they are going in opposite directions. So this is an alkalosis problem and it's a respiratory problem because they are going in two opposite directions, right? So that means that this is a respiratory alkalosis and I'm expecting the compensation to be metabolic, and it should be metabolic acidosis as a compensation. So this should be respiratory alkalosis with metabolic compensation. That should be B. 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 So why did the patient develop this? The question says the patient has anxiety attack, right? I'm just giving you an example. So the patient has anxiety. When Dr. Boni has anxiety, what do? I start hyperventilating. When I start hyperventilating, what do? I blow off carbon dioxide. And remember that carbon dioxide is acidosis, right? Or acidic, sorry, it's acidic. So I start blowing off the acid. Then what happens? I develop primary respiratory alkalosis. And when I've developed my primary respiratory alkalosis, the kidneys will try to lower the HCO3 to bring back pH. And therefore, that is where the metabolic compensation will come from. Doctors, I think this is the last question, and then you guys can jump into the class. You have a 50-year-old alcoholic man who presents with repeated vomiting. Oh, okay, vomiting. Oh, so the stuff will be coming from the stomach. And what's in the stomach? Hydrochloric acid. Okay, and that is why the pH is 7.50. So this patient is alkalotic. CO2 is also high because CO2 is between 35 and 45. So I have an alkalosis problem, and the HCO3 is between 22 to 26. So that's also high. So everything is high. So this is a metabolic alkalosis problem. So where will the compensation come from? Compensation will come from the lungs, and it will be a respiratory acidosis compensation, right? So I'm expecting a metabolic alkalosis with respiratory compensation, and that means the answer is A. So the patient vomits, loses hydrochloric acid, patient gets into primary metabolic alkalosis. The body responds by hypoventilating to retain carbon dioxide so that it can make up, for the alkalosis it has developed. So it is trying to generate carbon dioxide, trying to generate acid, right? And that is it. Doctors, easy peasy. Easy peasy. Easy peasy. So look, for those in the MedCognito class, you can just join the QE1 MedDrill class. And if anyone wants to talk to me, doctors, QE1 is not tough. I say it again, QE1 is not tough. So now that you've done this, go to your nephrology portal, acid-base balance. Deal with as many things as possible there, okay? Acid-base balance. Doctors, how was today's class? How was today's class? How was today's class? How was today's class? Easy peasy. Go to nephrology and palliative care. Go finish it up, okay? Remember that we have a 1-month package and also a 6-month package as well. Just give me a shout right now. +1 306 891 5649. +1 306 891 5649. Let's get talking. Easy peasy. Don't also forget April 21st mock exam. But for those in MedCognito right now, your teacher is waiting for you. Please join the class. Thank you very much for the participation, doctors. Thank you. And again, this is my phone number. Just send me a WhatsApp right now. A WhatsApp right now. That is my phone number. Send me a WhatsApp. Whether you're joining us from Nigeria, from Iran, from Afghanistan, from India, from Pakistan, come on. Send me a message right now. +1 306 891 5649. Let's get talking. Thank you very much, doctors. Thank you very much. It's been awesome. So, you know what? Just send me a message and let's get it going. Thank you, thank you, thank you. It's been a wonderful day and I've really, really enjoyed it. All the best. Please join the class. Join the class right now. Join it and start studying. Those in MedCognito, please. And if you want to join as well, don't forget to send me a WhatsApp, okay? Don't forget to send me a WhatsApp and I'll be very glad to help you. Don't forget to send me a WhatsApp on +1 306 891 5649. I'll be taking some calls right away, okay? So thank you very much. Have a good day. Bye-bye. Bye-bye. Bye-bye.